All right, Des, what brings you in today?
I have this like nagging hip complaint right now.
Yeah, is it going all the way down your leg, or is it only in the...
It feels like it's like right here in this region, like front of the hip.
Okay. It doesn't go in behind ever, just always in the front?
Always in the front, yeah.
What kind of things bother it?
Typically things like squatting, walking uphill, sometimes lunging if this leg's in front. I feel like that's when I notice it.
And, okay, and do you have any pre-existing problems on that side that you're aware of?
Not to my knowledge.
Did anyone tell you what it is yet?
No, I've tried doing some like Googling, Google, and it seems to be like it kind of feels like hip impingement to me, maybe.
Okay. Well, we're going to do an exam today, and we'll figure out what it is. If you have any questions along the way, just say something. But we're going to examine the whole hip just to make sure everything's all good, and then we'll do a little bit of a small treatment at the end.
Okay.
Okay?
Sounds good.
Go and line your back for me.
Mm-hmm.
Okay. So normally when we examine the hip, like, it's a good idea to compare both sides.
Okay.
Okay? And so the first thing we'll do is you let me know if any problems arise, if there's any pain there, or if it starts to travel anywhere.
Okay.
Okay? And so what happens if I bring your knee towards your chest?
It gets a little crunchy.
Crunchy? Yeah, like it's breakfast cereal crunchy?
More like, how about pinchy? Is that a better word?
Pinchy? Kind of like it's St. Patrick's Day, you wear green pinchy?
Yes, like that.
Okay. So let me know right when it starts.
Right about there.
Okay. And so this will sound really odd, but bring your hands down here.
Mm-hmm.
And can you push your fingers into your guts for me? There you go. Does that help your feeling at all?
A little bit.
A little bit?
A little bit.
Okay, go and relax.
Mm-hmm.
I'm going to go a little bit further. You let me know when it starts again.
Right there.
Okay, push your fingers into your guts again. Get real wide. Does that help you at all?
Yeah.
Okay, good. So that's good. So that means that at least this range of motion is not tolerated, but it means that a nice core exercise or core routine would probably help you out.
Okay.
The first thing, but we'll confirm more later. Okay, now we're going to check some internal rotation of the hip. Feels a little sticky right there.
Yeah, a little sticky.
Okay, is it duplicating the same problem?
Kind of, yeah.
Okay, and how about this?
That feels better.
Looks like good range.
Yeah.
Okay, now we're going to do a combination move where we go up and we're going to scour the whole socket of the hip on the inner part.
Mm-hmm. Right there.
You know, like that? Yeah. Makes you wrinkle your brow.
Yeah, right? Stop giving me wrinkles.
You're doing it to yourself. It shows signs of happiness when you have
Oh.
wrinkles. Crow's feet are like chronic happiness. Is that okay?
Yeah,
Okay.
sometimes I do.
Good. What happens if I push down?
That's okay.
Okay. How about,
That is not as okay.
okay. Is it the turning in or the pushing?
The turning it in.
Okay, good. All right, go and relax that. We're going to leave it right here. Do you have chickens on your socks? Okay. What spurred you today to wear chickens on your socks?
I don't know.
Okay. All right,
Feeling
so,
exotic.
all right. At least they're matching.
Yeah.
Okay, so just so for camera view, I'll say back a little bit just so we see this range here. And just comparing to the other side. That's okay?
That's a lot better than the other side.
Okay. This range.
That feels a little bit better too.
This range.
Yeah.
Okay. So we're going to actually compare real quick just to see the range. So this is your range on this side.
Okay.
If we're moving your leg like a clock dial,
Okay.
I'd say you probably hit a 5 or a 4 if I'm looking down on it.
Okay.
Maybe a 4. So this side, ideally we want to see it's kind of the same. You don't have to be perfect, but actually it is a little bit less, huh?
Yeah.
So it looks like you're about a 5. That side you're about a 4. So it seems like the range is a little less on this side. At least symmetrically it's different for you.
Mm-hmm.
You still have better than most people.
Okay.
Okay. Now for the other test on the side, just so you can compare. Check the outer part of the hip socket.
Feels
That's
fine.
good.
That feels fine.
Okay. Combination move to check the inner part of the hip socket.
Still feels better than the other side. A little sticky towards the end, but still better.
Okay. And lay that down.
Mm-hmm.
Okay, you're okay there?
Yeah, good.
Okay. Let's go face down.
Face down.
Actually, no. One sec. Let me check a couple things. We're going to check some of the muscle here real quick.
Okay.
Can you resist me? You okay there?
Yeah.
Push into me. Is that okay?
Yeah, that's fine.
Okay, good. So that means it's not your hip flexor.
Okay.
Okay,
That's a good sign.
I know, right? No one wants that.
No.
Push me up. Is that okay?
Yeah.
Okay, pull me down.
Right, it's okay.
Okay, leave that right here. Can you push into me?
Mhm.
Pull into me.
That's okay. Yeah.
Okay. Checking some of the rotators of the hip. Just don't let me move. Don't let me move your leg.
Okay.
Okay. Don't let me move your leg. That's okay.
Yeah, that's okay.
Good. So it's nice to see that all of the quality of the hip muscles are good. If we challenged you in this range or made you win into this range, it'd seem like it was a positive,
Yeah.
like there's a muscle problem.
Yeah.
But if we keep you in a range which is not painful and challenge the muscles, it's good to see that actually they're all normal.
Okay, good.
Let's go face down then. We got to check hip extension. Okay. Feels okay?
Mm-hmm.
Okay, we're just going to note here too, I don't know how the other side will look, but I'm just kind of noting how much space is underneath your knee, okay, versus the other side. And we're going to see if there's a difference. I'm kind of stopping where I feel the range kind of stopping me.
Okay.
For camera angle, I'll do it, I'll stay back. Feels maybe a little less
I would agree. I feel like there's a little more tenderness there too.
tenderness on the front.
Yeah.
I just feel like stretchy, pingy.
Like stretchy, yeah.
Stretchy, not like the breakfast cereal.
No, not like the breakfast cereal.
Okay, good. All right, so good. So what we're going to try then is we're going to try a hip extension protocol,
Okay.
because right now it seems like your hip is not tolerant to flexion and internal rotation. It seems like those ranges of motion really bother it.
Okay.
Okay, and so a lot of times just pumping the hip in the range opposite of the one that doesn't tolerate is a nice way to kind of perforate the joint, make it feel like it's happier, if you will.
Happier joints.
A happy joint. And so normally this won't hurt. If it does hurt, just tell me.
Okay.
And we're just going to go through about 20 reps, which is a really small dosage of what we could do possibly. And this is something that you want to do at home. There's a home version. And ideally, getting a little bit of overpressure like this it's a nice accelerator for the process.
Gotcha.
Okay? But the good news is for what you have, you should go completely back to normal. There shouldn't be any hindrance on what you're doing. You can still ride the horses. When's the last time you rode a horse?
It's been about a month or so.
Did the horse miss you more than you missed the horse?
They want their carrots.
Ah, it's greedy horses.
Spoiled
Go on your back
horses.
for me. And we're going to check that same hip range. I'm going to see if it still feels the same or it's changed at all for you.
That feels a lot more.
Yeah,
Oh my goodness.
there you go.
Oh.
Now the one that's a little harder is getting across, so that one might have to come in subsequent visits.
That actually feels a lot better.
What the heck?
Why'd that happen?
I don't know. How did that happen?
Yeah.
Magic.
Whoa.
Okay, cool. So yeah, you would have hip impingement.
Okay.
Okay, but if we were going to call it something just to give you some guidelines of what might bother it, it's a flexion intolerant hip. It
Okay.
doesn't tolerate flexion.
Gotcha.
So deep squatting positions for a little bit of time, maybe a no-go, stay in the range you can tolerate.
Okay.
If you like to eat in a really short chair for some reason, maybe don't do that for a little bit of time.
I don't know why I do that, but okay.
I don't know, that's your thing. Maybe the horse, like you get for the
Yeah,
horse, right?
maybe that's what it is.
Lunging to feed the horse on the
Yeah.
ground to make him bow to you.
Mm.
And then even stretches,
Oh, there.
even stretches like you're crossing across would be something that you're not going to do full, but
Okay.
great.
Okay.
So,
So none of these guys like up to your chest or anything
No.
like that.
and so that's a good question. So those ones not right now because
Okay.
it's not tolerant right now. It's not that you don't want to do it ever again. It's just right now.
Gotcha.
So we need to integrate that back in. And it's kind of the part of the rehabilitation process. You take something away that bothers people, put in something that is favorable, and then you start adding the other part back in again.
Okay, so that means I can do those things and I don't have to stop them forever.
Yeah, not forever. I think a little bit of time. We'll settle it down. We'll build some support with some hip exercises earlier, it looked like the core approach was going to help you too. So we need to do other things other than just pump the hip.
Gotcha.
We need to build support around the whole area, and that's just going to take a little bit of time and work on your part. I make the suggestions, but it's generally speaking, we just have to build a program for you.
Okay, that sounds great.
Okay. If you guys need some help, you can reach out to us. We're in Costa Mesa, California. And we saw Des in person here today, but we can do something similar virtually. We can suggest exercises and the right approach for you virtually as well. So all of our links are in the description below. If you want to learn a little bit more about what you have, what type of diagnosis your hip may have, we have a webinar in the corner, which is free. Take advantage of it. It's about 30 minutes, really worth your time. Subscribe to the channel. See you next time.